Well, hello everyone, it's Dr. Klein, and you probably can't see the screen. On my screen, it looks like it's a white screen, but I wanted to go on Facebook. If anyone had any questions about chiropractic and back pain and any of these video series that I've been doing, this is episode 7, I believe, of the Posture Report. So it's Dr. Klein, and it's posture time. Today we're talking about the rotator cuff and its connection to breathing and how many things as far as breathing can cause these tears we have or instability in the shoulders, and combination with that is the back pain. So a lot of this will be connected to other episodes and what we've talked about before, and redid episode 1 because it was a Facebook Live video and I kept flipping it back and forth. You couldn't see anything, so I just redid it with the screen record. So if you want to go on the YouTube, I'll post a link after, and you can see the videos in all their glory, whether or not just a white screen. So I'm screen capturing this as well, but I figured 2 birds with 1 stone. Let's get it done. So rotator cuff, let's at least break down the muscles. There's 4 of them, and which one is most commonly torn, and then we'll give the innate reason why, which is probably different than the main reason, as I've read a few articles on it. And then we'll connect it all back to breathing, because the last few videos have been breathing. The very last one we did was cerebral spinal fluid and breathing, and its connection to the spine and the health of the nerves. So there's always multiple connections with your health here, and how biomechanics is the best thing for you if you can learn some of the basic things here, right? If we can get good at breathing, because you do a lot of it during the day, it can be very beneficial. It's getting good at basic things. How you're walking, how you're breathing, how you're picking up objects. Not necessarily what you're doing for an hour in the CrossFit gym. Yeah, that's usually when you hurt yourself, but it's the little things beforehand that set you up for that injury, and the same is with the rotator cuff. So I think we got all 4 on here. This is the back of the shoulder. Supraspinatus, up top. That is the most commonly torn. Infraspinatus teres minor are commonly weak. Why? Because they're external rotators of the shoulder. And the guy that's chronically tight is subscapularis. So we try not to give exercises for this one because it's usually tight anyways, because it's pulling the shoulder internally, and most of the stuff we're doing at the gym, or especially me as a chiropractor, we're always in internal rotation, and we always got the shoulders hiked. Supraspinatus, sometimes it's tight and torn for that reason, but sometimes it's taut, and we'll get to that in a second. That's what causes the tearing. It's an overstretch. Ooh, okay, here's some stuff from Ortho Info. So yeah, this is talking about repetitive stress is the most common thing for tearing the supraspinatus. We already talked about supraspinatus being the most one, so it's degenerative, it's over time. So we talked about in the first few videos, micro trauma is the biggest thing. So breathing over time could essentially, if we're doing it wrong, be what causes the tear. I know, and we'll make that connection more. That's a little far-fetched for a lot of you, but we'll get there. Could be old age, bone spurs. Well, bone spurs are just degeneration over time because the body is creating bones, spurs, and arthritis because there's no stability and it's trying to lock this joint down, right? And this is a little different than the hip. They're both very similar because they're ball socket joints. And we talk about the hip a lot in foundation training. Hip tends to be a bit more secure, as long as you don't have dysplasia or something. The shoulder, a little more free moving, and it's more the rotator cuff's job to hold it in the socket. You do have a rotator cuff of the hip, but the hip is next week. It's the next episode, so I won't go down that rabbit hole yet. But the hip is a big problem, and it is actually connected to the rotator cuff, and we'll talk a little bit about how that connection works at the very end of this, and we might even get over some rotator cuff exercises. So here is what we mentioned. Is it tight or is it taut that's causing this supraspinatus tendon to tear? So a lot of times what we'll do is even take like a 5-pound weight, stand there, and first just raise it. What you'll notice is your shoulders will probably hike up, get that weight higher above 90 degrees, and your hips might come forward or your back might arch. Now try it again, get very straight and lengthened. Don't even need a weight, just do it with your arm. You notice you're not going to, if you really compress that shoulder into the socket, which is the rotator cuff's job mainly. It's to assist with motion, but mainly it's to hold that in the socket when your shoulder moves. You'll notice you're not going to get that arm up as much. So that causes the shoulder blade to be driven down as this glenohumeral joint, this arm is lifted up. So that is adversing forces right there, and it's going to cause that tear right in the tendon. So here's some pictures. So there's your supraspinatus tendon on top, tearing right there. And it's almost like a picture that's, I like this better than some of the pictures I've seen before, even when I was taught, because it's almost like the idea of this little tiny tendon. And it's a big, broad tendon. It almost looks more like a sling that's designed to hold it in the socket. And that's its overall job, is to, for stability, hold it in to the scapular, right there. So when we're moving it around, we're not overusing certain muscles like the deltoid is often overused, because that is the major, it should be doing the major job of abduction, not the supraspinatus. Sometimes it's partial tears like we can see over here, and that's your infraspinatus. So if you're playing around with your shoulder, the spine of your scapula is the big bone you're going to feel. So top of that is your supraspinatus. So feel both sides. If one is a little tighter than the other, sometimes it's sore and we think, oh, that's the tight side. You got to beat that out of your head, because sometimes the side that's sore and chronically painful is the overstretched. Think about a band that's just pulled apart. It's tight, right? But it's taut is the better word. So it's more susceptible to injury because it's already at that stress point. All it takes is a little nudge, because most people aren't injuring their shoulders doing something crazy. Like I said, it's over time. So it's just set up to sprain. So the painful side is not always the tight side. Get that out of your head. Like, I hear it all the time working on people. It's like, it hurts on this side. Why are you spending all the time on the other side? Because that's where it's tight. That's my job. I can't magically fix injured tissue. It's my job to fix torsion and what's tight and twisted. And usually when I take that out, it'll feel better, but that injury is still there. It's just we've taken the pressure off of it. Injury is still present. We're trying to take away what caused that injury to begin with, and that's the chiropractic approach. Let's get that spine aligned, because if that spine's twisted, the shoulders are twisted, the hips are twisted, and every movement you're doing is in this twisted place, and that's going to cause damage over time, which can eventually cause injury. So keep going to the chiropractor at least once a month, people. To save you trouble down the road and save you money down the road. It's one of the best things you can do, besides learning good, proper biomechanics and breathing, getting good at the basics. All right. So a lot of times it's partial tears over time, little micro tears, and then eventually full tear. And hey guys, if you have any questions, hit me with some questions. All right. Moving on. Here's some more pictures of the tear, just to give you another angle, some different look at the muscles. So a lot of times it's not ripping away from the bone, but that is usually where it's tearing, is right where it inserts into the bone. And it's usually, that was the question before, I don't think we really answered that. Let's read that question. Supraspinatus is most commonly torn because why? Well, we just kind of explained it before. It's the scapula is descending as the shoulder's lifting. It's putting it in that strained position already. But it's also because infraspinatus and teres minor, which are the external rotators, which can help hold it into the socket, tend to be a little weaker. So they're not doing their job, and that's kind of what you have to relax when we hunch and we raise that shoulder to do a lot of these overhead motions. It's not that the overhead motion is bad, it's too much overhead, it's just that you're doing overhead incorrectly, right? It's not what you do, it's how you do it. Never said that before. So here's a picture. Where's those? Yeah, let's get those lines in there. This is what we talked about in the intro video, the two different posture types, and we're coming back to those different posture types in all these videos, the runway model and the me, which is I'm the cheerleader. This is what I tend to go to. I know it looks funny to you, like nobody actually stands like that. I do, and when I'm not paying attention, the belly comes out, a lot of anterior pelvic tilt, and not only does that cause a lot of curvature in the lower spine, but in the mid-back spine. And it's kind of the opposite here. And we think straight spine is what we want. Not necessarily. This is the runway model, which is hard for me to get into. The first few times I took this picture, I actually looked really plumb line and straight, because it's hard for me to activate those glutes and tilt my pelvis the other way. So that's actually what I need to do more of, is tilt. And there's those original pictures, you could see that I was actually taller when I was tilting a lot. This one I kind of had to shrink and let myself come back. So the shoulder and the hip are not lining up in either of these pictures, right? They're the opposite of each other. the cheerleader tends to pinch the shoulder blades, and just pinching the shoulder blades doesn't actually activate the rotator cuff. Okay, that's more rhomboids, which can help pull that spine. And a lot of people have, like I said, the sway back when they lay on the table, they're flat, and you're like, that's not sway back at all. They're supposed to have lots of curve. I like to call it more forward pelvic sway. The hips have come forward in front of the shoulder, like we can see here, and it creates some little dipping curve here, more at the L5 sacrum area. But everything else is actually really kind of flat. The neck curve flattens out. Mid-back curve flattens out because they're really pulling those shoulder blades back, and sometimes they're pulling them up more than they're pulling them back. We'll see different variations of these two, but they're very, very common. I know at the runway and cheerleader, you're thinking like, these are women problems. No, a lot of men are runway models and cheerleaders too. Okay, men can be cheerleaders and runway models. Don't be sexist. But the lat connection is big here too. Like we said, we compress the spine to allow ourselves to lift that shoulder. So we kind of have to compress the spine. If we're lengthened, so that raising that shoulder is actually kind of harder to do. So a lot of exercises, you might notice that the hips come forward, the hips come back, and the spine compresses. And that's what foundation training is all about, is, hey, let's get these hips under the spine so we can actually lift the spine, activate those spinal muscles to help prevent pain. And then the breathing will be better. It'll be more from the diaphragm, because the diaphragm will be a better position. Talked about that in the pelvic floor and diaphragm videos, 2 separate videos, but very important for understanding both those, because we all have either diaphragm problems or pelvic floor problems, sometimes both. Usually it depends on these posture types. So we went over that in the playlist. And that's the connection there with the lat. Lat is very tight, usually on most people, and it could be either in either position here. It tends to be more in this, which it would be more of a lower cross syndrome. Not so much upper cross here, but there's a little bit, you can see that ear is a little in front of the shoulder. So this is upper cross, lower cross syndrome, where the lat would be tight along with the erector muscles and the quad kind of adversely pulling, creating that tilt. Pulls up the back, pulls the front of the pelvis forward, puts strain on the hamstrings. Diaphragm is pushed here, it can't engage properly to inflate the chest. And then we're seeing a bit of the opposite here, where the hamstrings are more dominant, pulling the back of the pelvis down. It's also all about balance, right? It's not about what's tight, it's about active stretching. The best of both worlds fixes both these. So foundation training should fix these. It's just we need some of this basic understanding of anatomy to really make foundation training work for you, because otherwise it's not the foundation training exercises that are magical. It is the principle behind it. Same with like yoga. It's not yoga that I despise. It's the principle behind it. And most instructors that I see as patients very compressed spines because they're missing this principle. Even if they're being active and teaching a lot of classes, you could have so much hypermobility, but yet contrasted by severe restriction, because you're just using the spine all the time to get into these poses, and you keep getting deeper and deeper into these poses thinking you're doing good, but you're never getting that stretch you need, like let's say in your hip. That is the most is actually coming from your spine, and that tends to lead to injury and often confusion. Like, yoga is supposed to be good for me, but in the long run it's not, because you're missing most of that strength element that should be combined. And that could be, that's not a broad statement. I mean, there are yoga instructors that do understand some of this stuff and do understand that we need more active stretching, that we need to lengthen the spine and not just try to get deeper into a position, but find the right position and then try to find the stretch earlier, which is a tenet of foundation training. Let's see if we can get that stretch in that rotator cuff without like warping our spine to get the stretch. Blah, blah, blah. Okay, let's return back to, actually let's show you some stretches here. So breathing, we got to go way back here. And you probably already have the concept already, but let's review it. Especially if you've done any decompression breathing before. So the decompression stance is the lengthening. And we actually want to get a little bit of the hip hinge here, and I'll explain why. I'll show you this in a second. but actively pulling the shoulders down when we're breathing, and then engaging that diaphragm. So you should feel, like we say here, you should feel the spine lengthen. Sometimes you think the shoulders come up and that's lengthening. No, you're pulling the spine apart with your shoulders, and that's not good. It's going to overuse that supraspinatus, and it's going to cause the tearage. So we need to pull, activate the rotator cuff, which is pulling it into the socket, broadening the chest, pulling the arms down like you see there. And then when you breathe from the diaphragm, instead of like pushing the belly out when you breathe, suck it in. And I'll even use my hands sometimes to pull the diaphragm down as I breathe in, pulling that diaphragm down, because that's what it needs to do. It needs to come down to allow expansion of the ribcage. And then you'll notice you're using a lot of those spinal muscles to lengthen the spine, expand the rib cage, 360 degrees expansion. That's going to break up a lot of the restriction that you feel. If you're going to the chiropractor and they're having trouble getting any movement in your mid-back, it's because you're not breathing correctly. And you're probably not breathing correctly, even if you're doing foundation training. If that's the case and you're not getting better, that's what you need to work on. And then we can cause damage to the rotator cuff if we're not doing that. Even doing simple basic exercises, we can damage our body. Even walking could be damaging if we're not doing it correctly. We haven't learned how to hold ourselves. We'll probably talk about that more with the rotator cuff of the hip, which is a term that probably doesn't even exist, but it should exist because it's the same concept that we're talking about here. There are muscles designed to hold your hip into the socket, and usually the hips are turned externally rotated in both these postures, and that foundation is broken, and the rotator cuff is broken up top, the breathing is broken, and the spine is broken, all because the foundation is wrong. But understanding the shoulders too is very important because that's all part of connecting that foundation. So let's run through some rotator cuff stretches, but we're going to try to do them a little more actively. And you kind of have to get the right stretch, you need to. Stretching the subscapularis, which is the internal rotator, and then focusing mainly on strengthening external rotation. That's the goal there. So that's talking about breathing, especially when you're doing these stretches. Think about breathing, because when you inhale, you're lengthening, you're going to feel that stretch a little bit better. A lot of times we're stretching, hold our breath, and just try to suffer through it. Or we're getting way too deep, like yoga, we're getting too deep into a position to find that stretch. So you're distorting the rest of the body to get the stretch where you want it. So if we're active about it, we can get that stretch earlier. So not only are we strengthening the spine, but we're getting the stretch where we want it earlier, so we're not causing any damage when we're doing it. Let's make sure we got all this here. Here's a final look at the postures. Here, this one's funny because I actually lined up. You can see that I'm raising the shoulders here. But a lot of tucking in the pelvis actually kind of leveled me out. Because that's where you want it. Ear, shoulder, hip, lateral malleolus in the heels, essentially where you want that line to fall. And like I said, this cheerleader is like my default posture that I've been working on for a while, so it's not as bad as this. It's exaggerated, obviously. And then here's the retraction and sway. Retraction is you're pulling the shoulder blades back and up, trying to fix everyone thinks good postures. I guess I call it the runway. It's because they kind of pull their shoulders back up to lengthen their torso, and the hips are very forward. So they've robbed Peter to pay Paul, essentially. And that's the trick there with the chest, is even if you're pulling your shoulder blades back and you're extending your spine, your shoulders can still be internally rotated. They can still be dominated by the subscapularis muscle, that internal rotator of the shoulder. So a lot of people think they have great posture, and they don't. And this is one of the reasons, is because it's an optical illusion. You're still turned in the shoulders. You've just leaned back or raised them, and the shoulders are still turned in, and that's the problem. Same with even me here. Still the shoulders turned in. I'm squeezing the shoulder blades together. And that's why I kind of hate that exercise. People are like, pinch a pencil in between your shoulder blades. That doesn't necessarily activate the rotator cuff to pull in. And that's one cool thing about foundation training. The principle behind it is that they really try to hammer that down, is not extending. Opening up the actual glenohumeral joint into external rotation, activating those external rotators, because it's a difference. It's a world of difference. It looks like the same thing to a lot of people, but once you understand the anatomy, you got it. All right, so let's run over a few little exercises. Let me open up the blinds so it's not so dark.